Hi everyone, myself Dr. Vinoth, Assistant Professor in Orthopedics. Today I will discuss about post-fracture diet plan or what are the foods that have to be added in our diet to achieve adequate fracture recovery. Every orthopedician will accept the fact that even after achieving perfect anatomical reduction post-fracture, there is a chance that this fracture may go for delayed fracture healing or sometimes even non-union also. So what is the cause? There are multiple causes, but one of the most common cause as well as least bothered cause is the diet status or nutritional status of the patient. So what are the foods that have to be added in our diet? Let's discuss in this video. Coming to the nutrition, first and important component is the proteins. Why we need proteins? If we take the total dry weight of a long bone, nearly 35% is contributed by the organic components. Of these organic components, nearly 90 to 95% is made by the collagen. For the synthesis of collagen, we require proteins. So take as much as proteins in your diet. How much proteins need to be added? We need to take at least 1 to 1.5 gram of protein per kilogram of body weight. For example, if your body weight is around 60 kilograms, you need to take 60 to 90 gram of protein daily in your diet. What are the foodstuffs that are rich in proteins? If you are having a mixed diet, if you take both vegetarian as well as non-vegetarian food sources, first and important thing is the milk and milk products. You can take it as whey protein, paneer as well as cheese. Second thing, eggs. Take as much as eggs as possible. Take at least 2 to 3 eggs daily to achieve adequate fracture recovery. Then you can add fish as well as meat in your diet. If you are a pure vegan, yes, if you take only vegetarian products, you can achieve your protein requirement by taking soya bean and its products. Yes, then you can take chana, yeah, green gram, green peas, peanut butter. It is having a very good source of protein. Then you can take it as seeds like flax seeds, chia seeds as well as spirulina in your diet. Second important component is calcium. Why we need to take calcium? There are three important reasons. If we take the total dry weight of a long bone, nearly 65% is made by the inorganic components. In that inorganic components, maximum contribution is made by the hydroxyapatite crystals. So this hydroxyapatite is made by the calcium and phosphate in a crystalline form. Yes. Second thing, for the bone healing, the first stage is called as hematoma formation. So which means a blood clot. For blood clotting, calcium acts as a factor for blood coagulation. Third thing, whenever a patient undergoes a fracture, he will be immobilized. Yes, whenever a patient is taking rest, there will be chance of muscle wasting. So for muscle strengthening as well as for muscle contraction, calcium is one of the most important nutrition. So for these reasons, we need to supplement calcium. How much calcium is required? We need to take at least 1000 to 1200 milligram of calcium in our diet, or we can take it as supplements also. What are the foods that are rich in calcium? If you are having a mixed diet, you can take milk and milk products, meat, eggs as well as fishes. Then you can take mushroom in your diet also. If you are on a pure vegan diet, you can take the following foodstuffs to achieve the calcium requirement. First and important source will be ragi. I will rate ragi as a better as well as a healthy source than milk, because if we equate weight to the ratio of calcium present, then ragi has a more source of calcium than milk. Second thing will be almonds and dry figs. Third, soya and its derivatives like soya chunks as well as tofu. Then you can take green peas as well as chickpeas. Then you can take cruciferous vegetables like cabbage, cauliflower as well as the broccoli. Some might have the doubt that I am having a hypothyroid. Yes, so can I take this cruciferous vegetables like cabbage, cauliflower? Definitely you can take, because as per the latest research, the goitrogens present in these cruciferous vegetables will be inactivated after cooking. So it is safe to take these vegetables mainly because they are rich in in nutrients. Third important component is vitamin D. Why we need to have vitamin D? Calcium and vitamin D, they both go hand in hand. So without vitamin D, how much ever the calcium we take, that will be excreted in our stools, they won't be absorbed. So for calcium absorption, vitamin D is required. Second thing, for bone mineralization, so how much ever the calcium and phosphate that is present in our blood, that have to be deposited over our bone. This is called as bone mineralization. For this to happen, vitamin D is required. Third thing, calcium and phosphate reabsorption. So how much ever the calcium and phosphate that is present in the blood, that should not be excreted through our kidney. So for the calcium and phosphate reabsorption, this vitamin D is required. What is the daily requirement of vitamin D? Nearly 600 to 800 international units is required daily. How to achieve this? First thing, you can take animal foodstuffs which are rich in vitamin D. Second thing, adequate sun exposure for 30 to 45 minutes daily will achieve the daily requirement of the vitamin D. Third thing, you can take it as supplements. Next important component is vitamin C. Why we need to take vitamin C? First thing, for collagen synthesis along with proteins, vitamin C is also equally important. Second thing, to achieve adequate wound healing after a surgery, vitamin C is also required. So vitamin C is equally important for both bone healing as well as wound or tissue healing also. What is the daily requirement of vitamin C after a fracture? Nearly 500 milligram of vitamin C or ascorbic acid is daily required. What are the foods that are rich in vitamin C? Maximum citrus fruits like orange, lemon, Mozambique, they contain more amount of vitamin C. Next thing, berries, green leafy vegetables as well as bell pepper, they also are rich in vitamin C. Next important component is iron. Why we need to supplement iron in a patient after a fracture? First thing, hemoglobin replacement. After a fracture, there will be a definitive blood lost at the fracture area. Second thing, after a surgery, there is also a blood loss. So in a patient with a normal hemoglobin status, this lost blood will be automatically compensated. That fracture will go for union. But if the patient is already anemic, if the patient is having reduced hemoglobin, then these patients are prone to have a delayed fracture healing or non-union of fracture. So it is better to supplement with iron-rich foods or iron supplements. Second thing, myoglobin. Similar to the hemoglobin, myoglobin also requires the iron for their formation. Yes, so during a surgery, muscles are going for the injury. So the myoglobin have to be newly synthesized. Yes. Second thing, after a fracture treatment, we will be keeping the patient in an immobilized state. So that time muscles will be going for wasting. So new myoglobins have to be synthesized to keep the muscle strong. Yes, or muscle strengthening. So that time also they require more amount of iron for the formation of myoglobin. So iron is required for the synthesis of both myoglobin as well as hemoglobin. So they have to be supplemented. What are the foodstuffs that are rich in iron? Most of the non-vegetarian foods are rich in iron. It may be red meat, oil fish or eggs. They are better absorbed than the vegetarian sources. What are the vegetarian sources of iron? Green leafy vegetables, especially spinach, contains more amount of iron. Spirulina has a very good source of iron. Peanut butter, yes, then you can take a tofu, green peas, jaggery as well as dates in your diet. Next important component is potassium. Why we need to take potassium? First thing, potassium is the closest buddy to calcium. Whenever calcium is reabsorbed through our kidneys, potassium will be excreted in urine to maintain the ionic equilibrium or ionic balance. Second thing, potassium is required to maintain muscle health as well as to prevent muscle fatigue. So if we don't take adequate amount of potassium in your diet, there is a chance that you will have muscle fatigue as well as the calcium reabsorption will be affected. What are the foods that are rich in potassium? Banana, orange juice, potato, nuts, fish and milk products contains more amount of potassium. The next important component is vitamin K. To be precise, it is the vitamin K2. Yes, why we need to have vitamin K2? Yes, because for the formation of osteocalcin, which plays an important role in bone mineralization or bone healing, requires vitamin K2 for their formation. The foods that are rich in vitamin K are green leafy vegetables, cruciferous vegetables like cabbage, broccoli, cauliflower. They also has a good source of vitamin K, as well as nuts also contains more amount of vitamin K. Till now, we have discussed the most important component. One more important component is the zinc. But I have already mentioned the multiple foodstuffs. They also contains zinc in very good amount. So you need not take a specific food for zinc alone. If you find this video useful, do like and share and subscribe to Dr. Vinoth's Medi360 channel. Thank you.